I am Ahmed bin Aslam, chairman of Typhoidable, which specializes in organizing awareness of the increasing spread and possible remedies of typhoid among the people. Today I am joined by Dr. Manzar Zakaria, who will provide us with an expert opinion regarding this topic. Sir, I thank you for giving us your precious time. Your guidance and authentic point of view will surely make our project better and educate many people towards this issue. Firstly, sir, for clarification, I would like you to introduce yourself.
My name is Manzar Zakaria. I'm a professor of medicine at PF Hospital, Islamabad, which is affiliated to Fazaiya Medical College.
Thank you, sir. Now I would like to direct your attention towards the main aspect of our interview, that is typhoid. It is said that typhoid is somewhat similar to the normal fever experienced by people in their day-to-day lives. To clear our confusion, could you briefly describe what exactly typhoid fever actually is?
Fever can be caused by many organisms. Fever could be because of infectious diseases, which can be of many types, because of cancer, because of autoimmune disorders. Now we are talking about a bacterial infection, which is spread by the Salmonella typhi bacteria. So the infection that is caused by Salmonella typhi and Salmonella paratyphi A and B. These are the names of the bacteria, and they cause the typhoid fever. Some people call it typhoid fever and paratyphoid fever as well.
To understand this fever to its depth, it is important to know its mode of spread. So for my next query, I would like to know that how does this fever spread? Can it be transmitted by animals to humans, whether it be directly or indirectly?
In my knowledge, typhoid bacillus spreads from human to human through orophycal route. When the excreta is mixed with our drinking water, and we drink that water, the typhoid can spread by that route, as well as if we eat some food which is contaminated by the typhoid bacillus. For example, flies sitting on feces and then they fly and sit on the food and we eat that food. Some persons are carriers of typhoid. If they cook the food and they can contaminate the food as well, it can spread by that route as well. So basically, we should say that it's a orophycal route.
If, for example, a person does not know how this fever spreads and unintentionally he or she inherits this disease, what are the symptoms of the disease so that one can be sure if they are infected with typhoid or not?
The most common symptom of typhoid fever is fever, and it has a very characteristic fever. It gradually increases over a period of 2 to 3, 4, 5 days. Rapidly rising fever over a few days is what we usually suspect to be typhoid fever. It can be mixed with other fevers as well, like malaria, dengue fever, leptospirosis. It is difficult to differentiate just from the fever what type of, is it typhoid fever? Yes.
Okay. There is always a conflict between different diseases that many have the same symptoms as each other. Are there any kind of special tests or methods adopted to be 100% sure whether one has typhoid or
not? One is a pattern of fever, which we have just discussed, a gradually rising pattern. And second thing is typhoid fever, and on physical examination, spleen may be slightly palpable, and there may be some spots on the abdomen, slight pinkish spot. They are difficult to see. And then typhoid fever patients can have headache, backache as well. So in the initial stages, so sometimes these are the symptoms. Sometimes the patients have constipation. After 6-7 days, they can develop diarrhea as well. And in the laboratory, the exact diagnosis is based on the culture of the blood culture or PCR of the blood. There's a polymerase chain reaction, and through that we identify the DNA, bacterial DNA in the blood.
After this procedure, when you are infected with this disease, does the patient have to endure any type of challenges, hardships during the period that he is infected?
Yes, typhoid fever takes its toll. It's a high-grade fever, it's high fever, swinging fevers, and even if it is treated properly, even then it takes 6-7 days to settle down, and it causes absence from work. If he's a student, he is absent from the studies for quite some time, maybe 2 to 3 weeks. And if these days, as there are resistance to typhoid is emerging worldwide, so it can develop. He may develop the complications of typhoid fever, which are very devastating.
I think it is a fact that most diseases have a cure. To better understand this, could you tell me that what type of medicines and vaccines are administered to the patients of the disease? To what extent are they effective?
We are talking about two different things. One is prevention of the typhoid fever. As you mentioned, we can prevent it by giving vaccines. So one method is the best way is to prevent it. We should vaccinate the population in the regions where typhoid is prevalent, like in our country, Pakistan. It is very much common. So I think there should be universal vaccination, and to my knowledge, typhoid vaccination is now part of expanded program for immunization. Second part of prevention is good hygiene, good sanitary conditions, use of toilets, hand washing, prevention of flies to sit on the food, cleanliness, clean drinking potable water. In Pakistan, almost only 30% of the population has access to the clean drinking water. Rest 70% are just drinking water, which is usually polluted with orophytal root. Sewage water, which is contaminated with sewage water.
It is said that this fever is mostly found in areas with filth and garbage in general. Could you specify for the audience that in which particular areas is this fever most likely to occur?
As we have already discussed, typhoid fever occurs when sewage water is mixed with the drinking water, one, and when somehow flies sit on the excreta of a person who is suffering from typhoid, and they sit on the food, and they can transmit the bacteria from there to one place to another. So to say that garbage, it's not the garbage. If there is garbage, yes, flies will be more there. Yes, it's indirectly related to that. But basically, it's the oral sewage contaminating the drinking water and unhygienic food. These are the two basic methods of transmission.
Now let's talk about the figures. We know that typhoid spreads rapidly, especially in a country like Pakistan, where hygiene is generally not taken seriously. Could you give me an estimate that about how many people in Pakistan are affected with this disease on a daily basis or maybe monthly?
I cannot give you the numbers, but you can tell you certainly that typhoid is quite common. It has a definite, many people die because of typhoid. It has a mortality rate, and definitely there are many complications of typhoid. Yes, so it takes a toll on the economy and human life as well.
I am curious to